Yes, and then on your way, you can go to Dr. Williams and come back.
We won't put only one on that.
And Enroll Wyoming is a division of Wyoming Institute of Population Health, which is part of Cheyenne Regional Medical Center. So we're based out of Cheyenne, but we're traveling around the state to our trusted messengers, which is you guys, to help educate everyone about how the Affordable Care Act impacts you and how to sign up for insurance through the health exchange. And at the Institute, our slogan is building bridges between healthcare delivery, systems, patients, and communities. And they're doing a lot of neat stuff down there with primary care redesign, payment reform, remote rural telehealth, and then with us at Enroll Wyoming. So lots of cool things going on. And today we're going to talk about the health insurance marketplace and how we can help you and your consumers, your patients, your neighbors as navigators navigate the marketplace. And we don't have a lot of time, is actually what it says. I think we have about an hour. It flows a little better actually if you want to just ask questions as they come up. Chances are if you have a question, someone else has it. And as a result of our presentation, hopefully everyone's going to be confident on where to go and how to enroll and how to get further help if you need it. And this is inherently a political subject, as everyone knows, but we're not here to engage in a political forum. We're really here just to promote education.
No worries.
Please. We are just messengers, and really the Affordable Care Act, whether you like it or not, impacts us all. So we're here to help make everyone make sure they make an informed decision.
We're not from the government, but we are here to help.
So we are the Institute, and you guys are the allies. And our responsibility at the Institute is to recruit and train navigators. So among our staff, we have 12 trained navigators, and we're hosting events at safety net clinics, hospitals, libraries, community centers around the state. And as a result of establishing relationships with allies, we have embedded additional navigators at the aforementioned places. So it's really a great way to get the word out because we can't touch everyone in the state without your help. We have over 24 events scheduled right now, and our hope is to hit everyone before December 15th, which is one of the first deadline dates if you want coverage to start by January 1st. And we'll get into dates a little later in the presentation. And at the Institute for Enroll Wyoming, we've developed some materials that you're welcome to take with you to distribute to your patients, neighbors, friends, family members, and we hope that they are of benefit to you. And they're also on our website at enrollyo.org.
They're on that table back there, and we do have more if you're interested. These are based on the government information. We just added a Wyoming flavor to it. You went over the Institute's responsibilities. We appreciate allies such as yourself. Without you, we wouldn't be as effective to get across the state of Wyoming. Reach out to all the communities, get this information out in the time frame that we have available. Also, it's nice to have contacts here like Douglas and Kylie to be able to coordinate access events, reach out to those that are underinsured, uninsured, paying too much for insurance. And also we're looking for anyone who's interested in navigation training, especially those that are in contact with the public, caseworkers, social workers, financial individuals. They're the ones getting the questions. And with this information, it kind of helps to lower both your levels because you'll have some guidance of information, or at least where to send them to get more information. I found it very helpful myself, and I was very cynical at first, but I was able to get a lot of information from this, and we've been able to help a lot of people with it. So we want to thank you for your participation.
So the role of navigators, which is us three, I don't think they introduced us. This is Devin, I'm Caleb, and this is George. So the role of navigators, our big push, like they said, the December 15th deadline is to educate a lot of individuals. We all, I'm sure everyone has friends that you hear something one way or another about the Affordable Health Care Act. It may be accurate, it may not be, but we're kind of here to give you all the accurate information. And we hope to alleviate a lot of the stress that goes into insurance so that people can make good informed decisions about their healthcare. We have expertise in the eligibility and enrollment process, which is actually applying and actually going through the application and finding out what you're looking for. We provide fair and impartial information. Like they said, we're not from an insurance company. We really want people to be well informed about their healthcare and get coverage that's going to best fit them. We assist in the consumer enrollment. If they want, we can take them A to Z on the application, all the way up to where their health plans are displayed. Just give them information on it. We don't choose one for them. That's all strictly their decision.
If you have staff in kind here or anybody you know that would like to have Navigator training, please contact us after the meeting. We'll get you in contact with them. All of our Navigators have been background checked. That's not a requirement. That's just something that we feel Wyoming we want to have done.
So no health insurance, don't let medical costs beat you up. And our real big target audience right now is people who have never had insurance, are underinsured, not getting the coverage that they really need. And a lot of people who are self-paid, just come in when they need it, pay right up front. And we really want to express what the benefits of health insurance can be for them.
And before we actually get into navigating the marketplace, I think it's important to highlight some of the provisions of the Affordable Care Act, because everyone hears information or misinformation from wherever their source may be, but highlighting what's going on is important, just to briefly touch on it. So one of the big motives of the Affordable Care Act is to increase the quality of care delivered and decrease the cost. And there are a few ways that this is happening. The big push is for free preventative care. So regardless of the health plan you choose on the marketplace, there's going to be a no copay visit to your doctor for a screening, a physical, colonoscopy, mammogram. Any preventative care or service is going to be free of charge. Discounted prescriptions for seniors, protection against healthcare fraud, and increased transparency with health insurance agencies, and tax credits offered to small businesses. Additionally, there are new consumer protections. One of the big ones is that insurance companies are no longer able to discriminate against those who have pre-existing conditions. Premiums are not determined on pre-existing conditions. You cannot be denied coverage based on a pre-existing condition. There are also no more lifetime limits on insurance payouts, which is huge for someone who might be really sick. Yeah.
So then on the application, does it say, do you have any pre-existing conditions?
It does not. It asks your age, your family size, whether or not you use tobacco. That's how premiums are determined.
You know what I'm saying? I can just say, well, since you had that, your insurance can be higher to cover it for when you need it.
Bear in mind, if you go out and open the phone book and find a broker right now, you want insurance now, they're going to ask. It's until the end of the year they can ask that. But if you're shopping on the exchange, or if you're shopping for insurance for next year, they cannot ask that. There are additionally new consumer assistance programs that are supposed to help consumers, especially those who are new to health insurance, understand what it means to have health insurance and put a summary of benefits and coverage in layman's terms, because those can be pretty dense to read sometimes. But we're also here to help everyone look over those if they need help. Additionally, young adults can stay on their parents' coverage as a dependent until they're 26, even if they are not on their parents' tax return. So for example, I was gainfully employed a few months ago. I turned 26 a few weeks ago. I filed my own tax return, but my parents had me on their health insurance policy. And greater access to health care. We want more people who have never had insurance or who have had a lack of insurance to be able to acquire insurance affordably so they can access health care services when they need it instead of waiting until they get sick.
Luckily, you don't have to hear us talk the entire time. We have fun little videos that are available on the website. They're pretty easy to find under the media part of it, and they're pretty helpful, so you can direct people that direction as well. With the new program comes new terminology and a lot of confusion. Even Jimmy Kimmel did a comedy bit, where he had people say, what's the difference between Obamacare and Affordable Care Act, which is the same thing, but they gave definitions of what they felt the difference was. As well as the marketplace versus healthcare.gov, G-O-V.com. And those are the same thing as well. They describe healthcare.gov as a marketplace to give you a feel of shopping for insurance. This video goes into a little more detail.
Question for you?
Yes?
So, when we look at this marketplace for Wyoming, is this any different than what people who haven't been able to get onto the government.gov? Will they see the same exact thing, or?
The first part of when you're enrolling and into that website will be generic if you're in New York to Texas.
Okay.
But then once you get into the part where you're looking at the coverages, then
Okay.
that's going to be specific actually only to you, not even the state of Wyoming. But
Okay.
it does have a drop down that says what state are you in.
Okay.
So the website you're talking about this whole time is healthcare.gov?
Healthcare.gov.
Okay.
So we have a federally facilitated exchange, so it's through healthcare.gov.
.gov.
Even when you drop down to Wyoming, it takes you through healthcare.gov.
Okay.
You can do all the things you do with more peace of mind, less worry, and more financial security when you know you've got health insurance. And now everyone will be able to find health insurance at the Health Insurance Marketplace. It's an online